Well, active shooter scenarios are one of those things that people don't want to think about. And so there are a lot of behaviors that happen in healthcare that we just assume are normal, and we don't kick them to the level of maybe I should report this to someone else. For example, disgruntled employees, coworkers, domestic situations with some of our coworkers, and then shifting to the patients and their families who are upset. There's not a whole lot of active shooter statistics in Canada, but the preemptors are certainly there with the unemployment rate, drug and alcohol abuse, the lack of mental health funding out there, where a lot of these situations are now moving from the community into the healthcare organizations. So it's important for healthcare organizations and security leaders to take a big look at what their program looks like, how they're educating it, spend the money and the time, because even though it's a low frequency event, it will be a high impact situation if it ever does happen at the organization. So the training and education has to come down from the top of the organization with the buy-in, and then move all the way down into the high-risk areas first, such as the emergency department, human resources, mom-baby units, and then out to the general population. Because at the end of the day, security's not going to be responsible for everything, nor can they. There's not enough devices, there's not enough personnel to do that, and everyone needs to own their own safety and security and be the eyes and the ears of the organization to get more resources directed to their particular situation or their area should a heightened awareness need to be implemented.